Good afternoon, everybody, and welcome to a special edition of Zahn Academy. I am so happy to have our Harvest team back again for the second time. And this time, they're going to be speaking about pink aesthetics for 3D printed hybrids. And I'm so happy to have Rob and Shanna back with us today. Thank you so much both for being here. Just want to let everybody know that we will have a live Q&A. So if you have any questions for either Rob or Shanna, please type them in at the Q&A section at the bottom of your screen. We will have poll questions as well at the end. So please stay tuned to those polls and answer them if you wouldn't mind. Just want to let everybody know that Harvest was gracious enough to put together a beautiful promotion for us that Rob will be speaking about a little bit later in his presentation. So please pay attention to that as well. We'll be talking about that at the end. And I hope everybody enjoys this presentation. It's wonderful. So thank you both again for being here. And I'm going to turn this over to Rob.
All righty, Fran. Thanks for having us again. Hello, Zahn team and everyone out there. Drop a comment in the Q&A or the chat. We'd love to say hi to you guys as we get started. And of course, ask questions anytime, and we'll handle some of those questions as we can in the flow. Shauna's really good with interruption because I interrupt her all the time, and she's good on her feet. So today we're here talking about EasyGum in partnership with Zahn, but more specifically, EasyGum on Rodin Titan for 3D printed hybrid provisionals. This is a great workflow for quick and easy pink aesthetics so that you're not tempted just to send the all white trying out. We can put some pink on there really quick. It looks really awesome. And so we have a promotion we'll talk about in a few minutes. So EasyGum is a gingiva aesthetic composite strip, and you can apply it in about 10 minutes flat if you're just using a strip, applying it around an arch, and you just want something quick and easy. It can be as fast as 10 minutes. You just use your fingers. It's pink composite in a strip, easy to use, easy to train. We're really excited to show you guys. And if you want to book time with Shauna one-on-one to do some private training, we would love to do that. Reach out to your Zahn rep and we'll get that coordinated. We'd love to support you guys and make sure all of your questions are answered, whether you want to just go super fast or if you want to elevate your aesthetics. There's a lot of different ways to use EasyGum. Here's a great case that Shauna did on a printed hybrid arch. We do have some intense modifiers that are flowable, and you lay down underneath the strip, and then the pink strip will go over the top of those intense modifiers. In this case, Shauna used original pink and light reddish pink, and then there's some pink modifiers she added over the top. And then to finish it off, we use speed polish a lot, a polish workflow, so that you can skip light cured glaze if you would like to. So we'll talk about the opportunity to do a polish workflow. If you want to use light cured glaze, of course, you can still do that. There's definitely some options there. So for our exciting promotion today, it's buy a bottle of the Rodin Titan 600 gram bottle for the $641 price. And then Zahn will also send you an EasyGum trial kit. This comes with 4 strips of the original pink EasyGum strips, the papilla tool, which Shauna will show, and the EasyGum bond agent. This is everything you need to get started with EasyGum, and we're excited about this promotion to support y'all. So we're going to just talk through a few slides, just 3 to 5 minutes, and then Shauna will go hands-on, live demo, and then she'll show you some stuff, and then we can, we'll jump right in. So Shauna, we'll take this together. So here's an arch. We're going to start with applying EasyGum bond. I know you like to use the paintbrush. A couple drops, apply it around the arch. It's 2 coats. Is that correct, Shauna?
Yes, I stretch it all the way to the one side to the other and then lightly go back over with the brush, making sure that you get into all the nooks and crannies.
Perfect. And then a light puff of air, not an air blast. And then we are going to go curing of the EasyGum bond. It is required to use a handheld light that has a higher nanometer wavelength. That needs to have a 430 to 510 nanometer wavelength. You can find this on the IFU page at the support.harvestdental.com. We have some EasyGum support documentation. You light activate for 20 seconds. Shauna will show that today. So then the bond will look shiny, but not sticky or tacky. It should not be slippery. It should not have any like tackiness to it. it will be shiny but dry, like a glossy finish to know that it's fully cured. Shauna does like to use some of these modifiers. Here's one of her favorites, dark red plum. Just apply it quickly around the arch, and then she likes to use a paintbrush to spread it around. Don't spread it too thin because you do want those colors to be more intense because they're going to shine through the strip as you layer it over the top. You can see she's just pulling down here. And then we go to dark violet if you like. She adds that. Shauna, you only add this in a few spots. This is for the what? The
I just
dark
add this
violet?
right where we have some like connective tissue where some
That's right.
frenum are. So it kind of gives it a more of like a darker undertone, like it would be blood veins or vessels underneath showing through.
Connective tissue and frenum. Those are the terms I was looking for. Thanks for bailing me out. And
Yeah.
then you like to use the bright red. I love this photo. Makes me hungry. And then when you go into curing of the EasyGum intense modifiers or the strips, you can cure with a wand or with a box. And so they're either one is fine. Again, all of these instructions are on our IFU at the Harvest support site. Then we go into the strip. You like to hand warm them with your fingers, not get them too hot. Place it at the midline, stretch it around, and then you're going to peel the black strip off and then start to use the papilla tool to scrape away what you don't want. Shauna also loves some silicone tip tools to shape and form those papilla. She also likes an Explorer. Shauna, I'm envious of how good you are with the Explorer. You do great work with that, very fast. But this is a great tool that you use to both scrape and to push and to form. And then
Yeah.
we got some Ivoclar paddle tools here.
Mhm.
And I mean, there's a variety of different paddle tools you can use. And then one of my favorites is this a scrub mommy or scrub daddy? I
This
forget.
is Scrub Balmy. It's got two sides, two different textures of sponges. I like to use different textures. You can keep it smooth or you can texture it, but sponges are a great way to give texture without having to like poke holes and press anything down into it, too far.
Love that. And then we'll go back to curing. Again, when you're curing the strips, you can use the wand or the box according to our IFU. And then you can lay some intense modifiers over the top. Here we got an endo file with some bright red, applying some veining. If you wanted to use a crosshatch carbide tool to do any final shaping or contouring, you can do that. And then we go into a speed polish workflow, stiff bristle brush, pick up the speed polish. It's going to be firm and dry. It's kind of, what do you say, Shauna? It's like a compound stick had a baby with a what?
Well, it kind of feels like a compound stick and like the pasty like type whatever. It like they had a baby and it got stuck in a jar. That's what it feels like. It's just a little bit softer than a compound stick, so it
Yeah.
feels really dense and dry, which I like.
We haven't met a surface that speed polish doesn't polish really, really well. Tons of small diamond particles. It works great. So stiff bristle brush is step one. And then Shauna moves to a felt wheel, get that finishing edge really nice. And then you finish it off with a cotton fluffy. And then you can see here, really shiny surface. And a high polished surface is going to reject plaque and bacteria better than a more porous surface. So it's really good to get a good seal on the EasyGum, and speed polish is a great way to achieve that. And then one more time, we got our promotion for those of you that joined late. Buy a bottle of the Rodin Titan 600-gram bottle for $641, and then you will also get an EasyGum trial kit at no cost. This is everything you need to get started with printing your implant provisionals and getting EasyGum on there really fast, really simple. So Shauna, I think it's time. We are now going to move to our hands-on portion, and look at you. You are all ready to go.
Here. All right. So yell at me if I scooch out of the frame. I have like the biggest arch ever. I decided to print.
That's a big one. Yeah.
I know. But we're gonna talk about a little bit of prep work. Um, Going into this, and this is completely optional, but it's something that I do like to do. So I'm really big on having my finishing edges be really super smooth as it transitions over. So I do like to do just a slight cutback. Now you can do this in design if you choose to. Um, I like to do it by hand. I'll use this double crosshatch. This is actually intended for like a Valplast material, but it cuts beautifully across anything printed, milled. I even use this on my zirconia to do a little bit of a cutback as well. But I like the blunt end of it. I'll just start and I'll go up underneath and kind of create a ledge so I can tuck the resin kind of up under, and so I can, when I go to polish, it'll be super smooth. And I have a couple examples I can show you what that looks like. And both of these are on printed materials. So you can see my transition lines are super, super, super smooth. And I can get that because I can kind of tuck the resin, and then when I go over with the felt wheel and polishing, um, it'll look like this.
And it's important to have a really smooth
Mhm.
transition just for hygiene, right?
Yeah, it is. It really is. I mean, especially if these are, if your patients are wearing this, post surgery, that tissue, the healing of the tissue is so important, and making sure that we're not really trapping any bacteria, any food, any plaque. They're going to have a hard enough time, keeping this clean anyways for the next couple of, months. So we need to make it as smooth as possible. But these are two of my printed prototypes, and it does have like the smoother texture. I didn't really put too much texture in these. But you can see where the shadowing underneath is the modifiers that I'll place that shine through the strip. I have two milled pieces, and so you can kind of see the difference of those. I'll use milled, and I'll use the Zerlux Temp, the PMMA, um, for a longer term provisional, which I do prefer. But you can see the difference in those. So I do put a little bit more detail in anything that I'm going to go a little bit more long term than I do with the short term printed. But it's up to you. So prep work, go in and you can create that little finishing edge. I have one here marked, and what you see in red is basically how I'll roll the burr across and concentrate on. I'm just kind of blending all the way through. After I've done that, I do like to sandblast. Just quick, I want to roughen up the edges here. I'll use aluminum oxide. I'll use 100 micron steam clean, and then dry really, really well, because you don't want any of your printed materials to be wet when you go to place the bond. I've already bonded one half of this because it's so big, but I am going to show you my bonding process on the other side. And I'm going to be using the Harvest All-in-One Bond. One drop generally gets me an entire birch. So a little bit goes a long way with this. And like Rob said in the pictures, it comes with those little micro brushes, which I'm not a big fan of in this particular application, because I feel like the little puff it acts like a sponge, and it'll just pick it up and put it down and pick it up and put it down. And I really can't get it out, spread it out evenly. And it's hard to get into these little hard to reach places around the papilla. So I like these disposable brushes. I buy packs of them on Amazon. They're super cheap. But I'll start at one end and work my way to the other. And as I'm painting, I want to stretch it out as far as I can get it to go. And my objective is just to make the surface look wet. You don't want to put so much on that it's starting to pull, because you'll have issues with curing. I'm making sure that I'm getting around that gingival margin. There we go. Once I get to the end of it, I'm going to go back over and making sure that I am covering everything. So I'm kind of stretching it out, and I'll even kind of roll over onto the intaglio Just make sure I get a really good seal. So a little bit goes a long way. There we go. So light puff of air. I know that our air guns are like super powered.
Don't be
Curing
afraid to
light.
ask questions, guys.
Yeah,
We got the Q&A
these.
box open, ready for questions if you guys have anything.
So curing light, I'm using a woodpecker LED 2. I like this one. It has a wider head on it. So I can cover about 2 teeth per section. So what I'm staying as close as I can to the prosthetic, I'm going to be moving in sections. So you don't want to wave the wand. You're going to want to stay in one spot and then move to the next spot. And it's going to be about 20 to 30 seconds per section. When I am completed with this, there's a couple of things to check to make sure that your bond is actually cured, and that's by touching it. It should look wet, but when you go to touch it, it's completely dry. Kind of like if you were to like glaze something and touch it. Um, that would be the texture. If for some reason that you touch it and it's still sticky, there's a couple of things that you can use to troubleshoot. Take a look at it. Does it look thick? If it is too thick, you probably need to thin it out, cure a little bit more. If like I'm losing my train of thought. If you didn't prep well enough, if the surface is too slick, you didn't open it up and the bond's not able to kind of settle in and sink into the prosthetic, you'll probably have some issues with that, or your light just doesn't have enough intensity. There we go. So as I'm going back, I'm touching, there's no stickiness whatsoever to any of it, but it looks wet and shiny. Let's see. My first step I'm going to do is I'm going to be the intense modifiers. Now there's 5 different shades of the intense modifiers. Uh, the 3 that I'm using today are my absolute favorite, and I use them pretty much on every single case. The very first one's going to be that dark red plum. And I'm just going to
Yeah,
be
and I know
placing dots. Go ahead.
I noticed you work pretty quick here, just big dots.
Yep. You can use the brush that you use for bonding, or I have a couple other kinds of brushes that I like to use. One of them being these brushes are for, I found at the art store too. They're for like model painting for like soldiers, like small little, I don't know, like cars and stuff like that. But the paint that they use is a little heavier. So it works really well with the flowable. Now, what I'm doing, I'm not really painting and pressing. I'm actually just touching it and then kind of picking it up and pulling it into the direction that I want. So I'm connecting the dots and then I'm pulling to the papilla. So I did have some people contact me like, well, when I'm placing it, it's like it's getting too translucent. Well, the objective is just to float it onto the surface and then kind of pick it up and swirl it. Scooch down.
And using the intense modifier is not required. You could
No.
just use a strip if you were just going for something like very short-term provisional, a patient was only going to wear for a couple days. You could just go straight to the strip, right?
Oh, absolutely. All right, and I'm going to keep going. I'm not going to cure yet. So I will take a little bit of the dark violet. This is totally optional. I just like to get a little extra.
You are extra.
You can't help it. And what I'm doing is I'm just touching that color and then just floating it. There we go. Last color is going to be bright red. This is really super intense. This is really going to shine through. Okay. Yeah, every time I do a case, I literally do the same thing every single time, which will increase your efficiency and your time. So I only allow myself a certain amount of time to do each of these steps so I can stay quick. Before I would have to find the syringes that I wanted in the colors, and it was really overwhelming for me. I know some it's not, but being ADHD, I like things to be a little simple. So this system really worked well for me. All right, so that's it. That's all I'm going to do for the intense modifiers, and I'm going to cure it just like I cured the bond. Starting at one end. This one's going to be a long one. I hope somebody has a question. Send me some.
So
Now,
for
when
this
I'm,
part, you
yeah,
you could use a light cure box, but you just
oh
like
yeah,
you prefer the
yeah.
handheld because you're extra and you just have your workflow.
True. I just don't want to get up and then go to the box, to do that. I have just from day one I just adapted to using a handheld the whole way through. Sometimes I like to tack cure um, with the bench, and then sometimes I'll go to the box and do a final cure. But for the most part, I just do the curing all here, all at once with the handheld. the the texture of the flowables is going to be a little bit different. So when I go to check it, I'll check it with an Explorer or with my nail and make sure that the resin is firm, but it will have a slick layer to it, and we do want that. So that's going to help sandwich the strip on top of it. So we don't want to take that off. So the bond is going to be dry. The intense modifiers and the flowables do have like a slick layer on them.
But then you can just move straight into
Yep.
your polishing workflow once it's fully
Yep.
cured.
Absolutely. And I'm trying to see if I can talk at the same time. So I have this really cool thing that I've been using here lately. So if you do resin a lot, basically any kind of fuzz or hair or anything in the room will find its way to you and then get stuck to it. So this is actually, it's like a car chamois, but they sell them on Amazon, like in art stores. But you could just have like a thicker car chamois and use that too. But I use that to wipe my brushes on, and it has been the coolest and best thing yet. I love it. I got one more.
Shauna, you have your Mac emojis turned on and you're giving yourself thumbs down, just as a heads up for
I know, I was looking over, I was like, oh my God, who's thumbs down to me?
you are.
Well, so be it. All right, last one. This is like the biggest arch. I could have picked a smaller one. Okay, perfect. So I'm going to be pulling my strip out at this point. I'm going to be using a light reddish pink today. And let me take this off here. I'm going to warm it. When you take it out, it's going to be a little bit chilly, a little cold. You don't want to place any heat on this. It'll get too gooey, too sticky. Just the heat from your fingers, and you want kind of the bendy consistency of like a stick of gum. And the reason why I do this is because if I were to peel it off and stick it, it would crack. It's cold. So warming it up will help make it bend and kind of mold it a little easier. And once I get that right, I'm going to take off just one side of the silicone. And I'm going to line it up with the midline. And I'm going to press press enough so it's not falling off. But I'm going to place my thumb right there where I press, and I'm going to just stretch it back. Now, this is actually a perfect example of, I'm going to have a little bit left over, but what I'm going to be removing, I can just transplant into these areas.
Yeah, so this is a good one. So you typically will always get
Mhm.
one full arch out of one strip for an implant provisional.
Oh, yeah. This is like a ginormous arch, but I'm just pressing. So it's starting to kind of squish out the bottom a little bit, and you'll get the feel for it. Now, this is a 2 millimeter strip, so I'll probably press it in maybe a half to a millimeter. And I'm kind of getting it into a little bit of these nooks and crannies. So once it's kind of set and firm, that's where I want it. I'm going to peel that top layer off. This is what I'm left with. And my first tool is going to be that Harvest papilla tool. It's got a little metal loop on it. This is what I'm going to be doing to map out the papilla. So I'm going to height of the gingiva. I'm going to press and scrape. Press and scrape. Now, on printed materials, you will get these little black lines. Don't worry about it. I'll help you. They'll come out. But what I'm removing, I'm actually just saving. Pull it back up. Kind of squish it with my fingers and then start pressing it in on the posterior, just like that. Doesn't look pretty yet. That's okay. We're going to do the same thing on this other side. I generally I do these probably in about 15 minutes. But if I'm using this on zirconia, I'm actually working under a special light with a warm setting. I'm using the Harvest bar light. I can get 30 minutes with the resin. You just want to avoid open windows.
Yeah, the new
Lots of
Harvest light we
sunlight.
just released is the Harvest Light Bar Motion. And you can also grab that item through Zahn. It is a motion activated light that has 3 different color temperatures. One of them is a warm composite setting, which would give you an extended working time, somewhere like 30 to 45 minutes. The contrast to that would be if you sit next to an open window, we recommend you don't do that because the sun UV light will start to cure the strips and your working time will be reduced. So a workspace that's away from a window, and then if you really want extended working time, the Harvest Light Bar is a great option for that.
The tool that I'm using now is just a silicone tip. I have a tip and then I have this one with the flat edge. I went with the flat edge because this thing's huge. So what I'm doing is I'm starting at the finishing line and I'm dipping a little bit of that bond onto it so it'll slide across, and I'm kind of painting downwards. And what this is doing, it's thinning it out so it's a little less bulky. It's also pushing out any air pockets that might be behind. And it's not going to be pretty yet, but it will be. I'm kind of pressing it down into the papilla. Now you can remove whatever's kind of rolling over on the intaglio now, or you can do it later. It's up to you. But I just like to use an explorer. You just basically do that cutting motion, press it back into place.
If you take that uncured resin, put it back in the
Mhm.
container and save it, you can use that,
Yep.
days or weeks later, as long as you keep it out of the light, correct?
That is correct. I put it all back in there. And I'm going to be going in with the Explorer now. I like the Explorer because of the tip and actually the back end of it. So the tip can really get down into these hard to reach places. And I like the back end of the Explorer to help kind of press and push. So kind of alternate going back and forth, concentrating on getting the papilla where I want it. You could use the silicone. I just found that the EasyGum is it's a little firmer. And one of my favorite things about this resin is wherever you place it, it stays. It's not migrating. I don't know if you've used other resins before and you've had the issue where you've had to actually do it in sections, because if you were to put it all on once, it would either cure on you or it would migrate. You would shape it, and then a couple minutes later you'd have to go back and shape it again and shape it again, because it would start to kind of drift downwards. That this is one of the key things that I really liked, because I could stay super efficient and I could get the strip, all the resin all in at once without having to do, small sections. And I can go back in with use this just to smooth. Sorry. You know what, Rob? I think this case that I have in my hand is my very first case I did EasyGum on. Remembering it.
Oh, really?
Yeah. I remember when you sent it to me, you're like, here, give it a try. And I'm like, all right, fine. This is the case that I actually did that first one on.
Oh, it sounds like you weren't very excited to get that gift from me. I'm gonna hold
It
that against you.
was, it was, I actually fell in love with it. I didn't want to,
I know you were a
but
little
I
skeptical, but then you were like,
was.
oh,
I was really struggling. I was like struggling to find a resin that was, you know, I wasn't having to spend forever, because it was taking me like 45 minutes, to get everything on there. And sometimes even longer, because I had to pick all the colors, and it's the way my brain works.
talk a little bit about how EasyGum compares to other
Mhm.
traditional syringe composites. Like it's a little firmer, it doesn't slump, right? And
Yeah,
then the shade system for the EasyGum, you said you liked a little better.
I do. I really like the translucency. These follow like the Lucitone shade guide. So it's colors that I'm familiar with and I like using. Sometimes I've had some other syringe composites in the past, so they're just a little too orangey. Um, so I was struggling to get, more truer pinks. One of the reasons why I really liked this. I liked it because I could get it on fast. Wherever I put it, it sticks, it stays. This is where I'm at here. So you can use the back end of the Explorer also, and you can get a little fancy if you want to, or just keep it nice and smooth. I'll keep it smooth today, but I will show you what I made to get a little texture. Is I took a sponge, the other side of the Scrub Mommy, which is softer, and shoved it down into this little instrument. When I'm completely done and I want everything where it's supposed to be, I'll go over and just kind of lightly press, and it gives me like a super natural stippling texture in a fast way across it. So when I go into hand polish, this will still be there.
And if you didn't want the stippling, you could just keep the surface
Mhm.
smooth and
Oh
then
yeah.
it'll look smooth.
There we go. And just like I did before with all of the others, I'm just going to cure for 20 seconds per section. And this doesn't require any gels. You don't need to do anything special. It doesn't have any long-term curing. Once I'm done curing, it's cured. I'm ready to just go straight into polishing. If I do, for some reason, need to adjust, I'll use the double crosshatch. It's like a flame, or I'll use like a medium grit needle diamond to get into those little nooks and crannies if I need to blend something. But other than that, I'll just go straight into polishing. And printed materials are a little tougher. Rodin seems to be a little easier to polish. I prefer polishing over glazing, but you can absolutely, glaze if you need to. I just don't like the way that it discolors, and in some environments in the mouth, it does tend to break down and peel away, and collects a lot of plaque and bacteria. So I really like using this speed polish on the tissue and on the teeth as well. And I'll show you what that process looks like. I do have a case where the one that I showed you this sample of, I actually used the pink translucent on the teeth, um, and it actually came out looking like glaze. And it's not tinted, which was pretty cool too.
Yeah, some of the polished arches you've shown me are
Mhm.
incredible. It's like almost unbelievable that there's no glaze on there.
Yeah, the small particle size, this resin, I mean, it has the texture of like clinical resin, like we're using for fillings. And it just gets a super high, smooth shine that I really haven't been able to achieve in others.
Yeah, this is a product that Harvest manufactures ourselves in Brea, California. We buy in the raw material and we're milling down these particles to a really small nano size. And so the way the material behaves in a polishing workflow is incredible. Oh, I know what you're doing here. You're showing us the Explorer test to make sure it's fully cured, right?
Yep. So I'm going to run my Explorer. I mean, so there's no, and you can kind of hear it. It's going to make that high pitchy noise. And I run it all the way across just to make sure, um, because I'm not putting this in a box and I'm using by hand, I want to make sure that I wasn't like spacing out and forgot to cure this one little spot here or there. So I'll just go through and check it with that. From here, I'm just going to go straight into polishing. I use the three tools, the bristle brush, felt wheel, and the cotton puff. The bristle brush is going to be my first with my speed polish. And it's a clean one, Rob. See, look.
Oh, thank you, Shauna.
I'm always a mess. So I had to bring out a clean one.
I told Shauna you have to have a special webinar speed polish that's nice and clean.
It's fancy, the fancy one. So I picked a little bit up on the brush. I'm going to concentrate really on the EasyGum first. It can actually take a little bit of pressure. And I'm going to do half and half so you can see the difference. So right at the finishing line and kind of rolling over to the papilla. And you'll go ahead, you'll start seeing some of the shine sort of popping through. But the texture is staying behind, which is really nice. A lot of people are like, well, can I take it to the lathe and do it? You can, absolutely. I just prefer this workflow because it's just a smaller space. And I don't know if you've ever gotten one of these hooked in the rag wheel and it like flings and slams into the, the back of the thing. You have like a heart attack. So I'm using some pressure. I'm heavy-handed. I'm not being shy with the speed. So I'm getting there. So we're starting to see a little bit of that shine pop there. The next one that I'm using is that felt wheel. I'm gonna pick some up on that. I'm really gonna concentrate on the finishing edge and rolling over. Same pressure, same speed. I'm not gonna be shy with it. This is really gonna give you that smooth transition line. Very last one is going to be the cotton puff and nothing on it, just plain. We're going to buff out whatever's on here. And I will carry this down and over the teeth. This cotton puff works really well with these printed materials, especially this one. I'll put a little bit of weight into it.
And so you can get a decent polish on the printed
Yeah.
materials like the Rodin Titan. There's just a slightly different
Titan's,
porosity to printed
yeah.
materials versus like the milled Zerlux. You maybe show that again at the end.
Good.
An incredible surface finish, and obviously because it's milled, it just polishes really, really beautiful.
Yeah, you're gonna get a lot more translucency out of the milled products than you do with these printed ceramic materials. They have got, like, a density to them. A lot of people ask me, well, how do you stain the teeth? I don't. These are short term. I've never had a patient go or say, I don't like this because I don't have enough translucency or there's not enough cervical, color to, give it shape. Typically, these are going to be used out of surgery, or for a few months in healing phases. As long as they look nice and they're shaped, the way they want to. I want them to be. White's good. They're white. I think the last thing is it stained? I will do that, in a long term provisional versus these. So from here, so we have the polished side and the non-polished side, which polishing it with the cotton, and you can actually put a little bit of alcohol to get some of the lines off if you need to. I would take this over and steam clean it, but I'm not going to go that far. So I'm going to put a little alcohol in it and try to wipe off so you can really see. It polishes up pretty nice using that. And
Wow.
again, this
Yeah,
is,
it's amazing.
yeah. So these are my two printed. So this is actually in a printed tri material. So it's not the same as the printing ceramics like the Rodin. So this is you're going to see a little bit more translucency, but this is literally 4 tri-ins. It's not going to go long term. It's not going to go very far. These will, and on here you can see this, the two front teeth are not polished. I actually used a pink modifier, which is the pink translucent. And I very thinly painted that on, kind of like a glaze. So it's not thin, it's not going to peel off in any way. And then again, these are the milled provisionals, which when they're milled, they have like a multi-layer, so you're going to get a little bit more of the colors going through. But yeah. Do we have any questions? Now, one thing I will do too is with the pink modifiers, if I go back in and I feel like I need to close any of these little these gaps, because I don't want food getting packed in there. I'll go back in with the pink modifier, a shade lighter than what my base shade is. Now I will go back and probably with the burr and then steam clean it, air dry it, and I will apply just a little bit of bond on my brush, in these areas to make sure I get a really nice and tight seal. And I'll just put a little bit of bond, I'll cure, and then add that pink flowable, um, and then kind of move it with my Explorer, cure it. And generally, you don't even have to polish it because it's going to come out super shiny. Yeah. That's it.
Amazing. So guys,
Yeah.
any questions for Shauna before she comes off camera? Or we have a few minutes if anyone has any questions, or maybe Fran, do you want to throw out some of your poll questions?
I do. I have
Mhm.
a couple of polls, but please, if you have any questions at all, pop them right into that Q&A section, because we love questions and we love you guys to be interactive with us. Okay, so the first one is, are you looking to add EasyGum to your printed hybrids or your millable as well? You could just let me know if you are interested at all. I'll be more than happy to give you a call. We could talk about what it is you want to do with it, and we'll talk about what the promotions are and get it to you as fast as we possibly can. So, does everybody see that poll question?
Sasha said the question disappeared.
It disappeared.
He loves texting me during webinars.
Oh, I don't know what happened here. Okay. So
Bravo.
we'll launch the next one. I don't know why that disappeared, but if you're interested in the Rodin Titan EasyGum promo, and if you didn't get a chance to answer the last one, you could just answer yes if you're interested in also just adding EasyGum, and we'll discuss that when I give you a call at your laboratory. And I just want to let you all know that we are recording this. So in the next couple of days, in your inbox, check it. You'll see a thank you for joining us or registering, because anybody that registers for any of our, Zahn Academy presentations will get the recording the very next day or the day after that you can watch over and over again. Everything does live in YouTube as well. So.
And Fran, Shauna's here full time to be a resource. So if any of the Zahn reps want to book a call with Shauna and their lab technician, we're happy to go one-on-one just like this and do a private training with anyone out there. We just got a
Oh, that's
question
wonderful. Yeah, we have a question here.
from
And
Jason.
yeah,
Go
he
ahead.
wants to know if it's the same protocol for a PMMA.
It's very
Yes.
similar. Sean, I'll let you answer that.
Yes. So nothing changes. So any kind of prototype versus printed versus PMMA, it just depends on if you want to get a little extra with it, you can, but the protocol is exactly the same for all prototypes. Yeah. I don't know if y'all can see, but look how you see how big this arch is
You were
compared to like
hustling.
north.
You were hustling.
It's huge. I'm like
Wow.
cracking up. I'm cracking up over here. Like dang. But yeah.
And again, Jason, if you want to see that, you can go right onto our Zahn Dental YouTube page and you can watch
Mhm.
that last webinar. Absolutely. It's there
Yeah.
for you to see. And we have our next poll. Are you interested in a 3D printer before the end of the year? Pay attention if you're looking for any type of equipment. Of course, Zahn, we're here to help you. And also think about end of year section 179, taking advantage of that tax break. You can speak to your accountants about that, but that's something that, if you're interested, we can definitely talk you through that. And there's tons of promotions that we can offer. So if you want to get
Who
into
doesn't want another printer,
3D
right?
printing.
It's kind of like another handbag, right? Everyone
Oh,
needs one.
yeah, of course.
All right. I'm that girl. It's absolutely.
Oh, we have some more questions. So the next
Yes.
one, how long does it last on zirconia?
Yeah, so
I have a, oh, go ahead.
go ahead. Go ahead, Shauna.
I'm sorry. No, I have a few. I've been work strictly with, particular, I use nano zirconia, but I have a few live cases out there that I'm going on a year, and I check up on them quite frequently, and they look fantastic. They look just like the day we delivered them. And it's really interesting too, because on zirconia, um, it kind of reacts a little different than you would think it would. This is an arch with easy gum on it, and it feels like ceramic. I'm a ceramist by trade, so it's really super cool. This is actually a half and half, so this is half ceramic and half easy gum. But if you were to close your eyes and feel it, it's really hard to distinguish which is which, unless you
And
really
one of
get up
those,
close. Yeah.
one side is ceramic glazed and the other side is just polished.
Just polished. Yeah. So I have this is a fireless workflow. So this never sees an oven on this one. But I
And
also,
we
so this is an example of not polished and green, but this is also like a smoother type texture. So, some doctors do like these no texture, smooth, nice and round, good transition lines. And then this is a little fancier with the texture. So you have the ability to, put the art behind it, whatever way you want to go. But I've had great success with the zirconia. The workflow is a little different than the prototype. The prototypes, I want to get it on there quick. I want to get it going, get it out. I do take my time on placing this on zirconia. And I use a lot more of the pink modifiers, flowables, and hand mixing.
Shauna, Janos wants to know, did you say that you put pink modifier on the centrals?
Yeah, Janos gets 2 stars for paying it close attention.
Yeah.
Kudos to you, Janos. Shauna, explain what you were doing there.
So I don't know if I have it next to me. I don't have the pink modifier. So we have they're a little bit of a thicker syringe. So these match the strips. And we have in there, it's a light pink and it's called translucent. And the translucent, I'll just squish a little bit out either on my glove or in a little dish. And we'll pick it up. It's a little bit thick. So I'll place it right here. And then I'll start kind of like working it down. And if you just let it sit for a second, it just kind of spreads out. And then I'll work through it and thin it and thin it and thin it to where I want it, and just let it sit, and it kind of disperses. And it looks beautiful. It really, really does. There's no pink tinge to it whatsoever, because I allowed it to kind of disperse and pressed it in and down. But if you really want and need that like high super shine, which I know some people do, it just, it's preference. But this actually worked out really well. I'm pretty happy with that. And I'm picky. But I just placed that and then cured it with the 20 seconds, and I just kind of left it alone and let it be, and I polished. So it will have a little bit of tackiness to it. So I really didn't want to lean into it with the felt or anything. So I just went straight in with this naked cotton fluffy, and it just, shined up really nice on those. I hope that answered the question.
I think so.
We have
Cool.
another question. Do you
Yeah.
bond the same way on zirconia?
Do I do what on
The,
zirconia?
Do you bond the same way on zirconia?
Yeah. So prep work on zirconia is extremely important. And I do say you have to use the Harvest all-in-one bond. It was intended because of the strength for that. So sandblasting the tissue area is very important. Now, a lot of people ask me, well, can I glaze it and stain it first? Because I don't, I'm not able, I'm using a different zirconia. I'm not able to polish that way. Of course, your first steps are going to, stain and glaze your teeth. When you're done, take that out. You're going to have to sandblast in these, nooks and crannies. So you're going to have a sandblaster with a precision tip that you can get into these areas with 100 micron. And so you can open this up because you baked it it's basically kind of sealed up. You need to open it again so the bond can seep in. Once you've sandblasted, you're going to steam clean, dry, and I'm going to place the bond on the same way, nice and thin, even coats all the way across the arch, making sure, really make sure that you're really getting into these nooks and crannies. Take your time. And, that's really important to have that bond strength in these areas. I will go back and do a second coat completely across from one side to the other, making sure that it's still staying very nice and thin. It's not pulling, it doesn't look thick. When you look at it, it shouldn't look, if you see yellow because the bond itself is yellow, you need to thin it out. Do the air, and then you're going to cure with the curing light for 20 to 30 seconds per section, and then do the finger test to make sure that you don't have any stickiness. And then from there, I use a lot more of the flowables, the pink flowables as my base shade. And I'll actually place my strips on in sections in these places and then actually pat it out. So my goal is not to have like over bulked resin. I want it to resemble and feel and look like ceramic. I don't want it to be super bulky. So that's why I take my time and actually put this in sections and really thin it out and either keep it smooth or I'm gonna, put texture and some anatomy into it. But yeah,
Great questions, everyone.
Yeah, they're
absolutely.
really great questions. We appreciate you all joining us here and being so interactive with us. I just want to let everybody know what's up next week on Zahn Academy. We have Daniel Alter, and he'll be joining us for a comparative 3D printing for digital dentures. So he's going to go through all the different types of 3D printers that are out there, whether SLP, DLP, jet printing. So that's going to be a really good one for everybody to join us with. And then on September 24th, we have Dan Morano, and he's going to be joining us speaking about mastering implant crown fabrication featuring DES implant components and Ivoclar
Awesome.
multi-link cement. So he's going to be going through that entire workflow down to cementation process. So that's going to be, another one we really want you to join us with. And in October, Van Hook will be opening up their doors. We're going to have Hunter DiMaggio joining us, and they're going to be explaining why they decided to go with automated finishing and polishing. They're using the auto finish now, and they are so happy with it. And they're going to be talking about ROI and the reasons why they decided to go and make the investment for that. Zahn Academy is also on the road, and we're going to be in Lexington, Kentucky on the 18th and 19th of September. On the 18th, we're going to be having a full day of exocad training from the basics all the way through to All on X. And then the very next day, our road show, all demonstrations and 15 manufacturer partners joining us for a mini trade show. So we're so looking forward to anybody joining us that's in the area or wants to join us at beautiful Lexington, Kentucky. It's a beautiful place to travel to. I don't know if any of you have been, but it's beautiful. So we'd love for you to join us for 2 days of hands-on training, demonstrations, and mingling in with, all of the top manufacturers that are out there. So I think we have another question, Sham. So hold on one second.
Good question.
Okay, so we have someone asking, do you ever apply the EasyGum on the linguals of zirconia?
Yes. I use the pink modifiers because I do thinner layers. I feel like the strip's a little bit bulky for the lingual, but I will say that I do my cutbacks by hand. A lot like I do with the prototypes, but I'll do this in green state prior to centering to make sure that I get some really nice finishing edges. I will give myself a little bit of space on the lingual if possible, because I want that transition to look really good. But I'll use the pink modifiers versus the strips because I can get it to be a little bit thinner, a little smoother, and the tongue, appreciates that. You don't have to. That's absolutely a preference. I have some that have it and some that don't. And that's, if you want to, you can, but you don't have to at all.
Well, I thank everybody for joining us here at this special edition of Zahn Academy. This has been great. Shauna, thank you so much for opening up your
Yeah.
practices to, all of our customers out there. We really appreciate it. And Rob, thank you so much for joining
Of
us
course.
again, all of you at Harvest. We appreciate your partnership. Thank you for the great, promotion. I'll be definitely checking in with those that answered yes to any of the poll questions. And I hope that all of you have a great day. And I hope to see you again next week on Zahn Academy. Thank you so much, all. Have a great day.
Thanks, Fran.
Great
Thanks,
evening.
everyone.
Thanks.
Bye.
Bye.